Hi, everybody. This is Susan Collini from the Renaissance Center for Plastic Surgery and Age of Innocence. And today, April the 5th, which is my son's birthday, your brother. So we have to say happy birthday, Joe. Happy birthday, Joe. Have a shout out. I actually missed last month. I was on vacation, so you had Derek. Derek was our moderator and our host. So let me introduce everyone to you, the team for today. Over here on my right, your left, is Ronnie, who's our medical assistant, our IT guy, our chief cook and bottle washer. When you need anything, we call Ron. Yes. And then, of course, Derek, who is our laser center director. Again, I'm Susan Collini. This is Lauren Carey, and she is also here, part of the AOI team, and she's here to talk about something that we're going to talk about in a minute. And then, of course, we have Ashley, who is one of our nurses up in the Renaissance Center and the office side. Oh, she also is here at Age of Innocence because she's a licensed esthetician as well. So I think I have the team. Yes. So this is a really strange month. We try to coordinate topics of conversation based on what we might see in the media, or when we know that somebody like Hallmark has decided that there's an awareness month. And I don't know who the awareness people are, because it's not Hallmark. They don't have a card for it. So there is some kind of an awareness month.
Dermatology.
And somebody did that. So this month, believe it or not, there are two awareness, and so we'll talk about those. One is Rosacea, which we'll do second, and then the first one is Odor Awareness Month. So that's like a little strange.
Odor awareness.
And so we have tapped into our Odor Awareness Month because it's basically mirrored with Miradry and removing or addressing and treating sweat glands and hyperhidrosis. And we've talked about this many times before, but I think there's always somebody new that jumps on the bandwagon, so we like to include that information. So one thing that people don't realize, we've talked about hyperhidrosis and the treatment of our laser Miradry. We've spoken about it, but people don't realize it also eliminates, besides the sweat glands, it removes odor, which is really a great thing. So I'm going to lead in and let Derek start jumping on board, and then we'll have two of our staff who have had the treatment and can vouch for it, and we'll talk to them in a second.
Absolutely. So Miradry, which we've talked about a lot on our segments, it's a pretty straightforward treatment. It uses heat to kill the follicle. So basically when it does that, it is eliminating sweat, hair, and odor. The reason it's eliminating that odor is because it lives on the sweat that's underneath your underarms. So as you see that, perspiration start to lower itself, you start noticing that you don't have odor anymore, you don't have to wear deodorants, and use any of those harsh chemicals. So it's kind of just like, it's kind of a cause and effect of Miradry, but there are a lot of people who do deal with odor no matter what they wear. It's actually the type of bacteria that is living on your specific skin. So it is a medical condition. It's not something that's, you just are unclean. It's just the way that the bacteria is procreating under your arms.
And deodorant is just really bad for
Very
you.
bad for you.
It's really bad for you in general. So if you can do something to eliminate having to use deodorant.
Absolutely.
I know Derek knows a lot more about the ingredients in deodorant and why they're bad for you. I just don't know what's bad for you.
Well, and what happens with a lot of people, they use all of these deodorants and they have a lot of breakthrough odor because it's only lasting half of their day and it's embarrassing. So it's something that typically within 2 treatments we notice almost total elimination of the odor underneath the underarms. So what was your experience with Miradry? Did you ever suffer with any kind of odor, or either of you? Or
Not really. It wasn't an odor thing. It wasn't a sweat thing. For me, it was just like wearing deodorant. I knew it was bad for you. I didn't want any complications in the future, or just having anything bad going on with like the aluminum and all the other ingredients with the deodorant. And I just sweating's a pain. I mean, I have like a tiny bit, but nothing like any hyperhidrosis issues or anything. But I was happy that I got it because now I don't have to wear deodorant, and then that little bit of odor and a little bit of sweat that I did have is gone, so I don't have to worry about it.
And that's a really good example because Ashley explained you don't have to be excessive to receive this treatment. It is a laser treatment. It's a little more invasive than our standard lasers, but it's not like you're going under anesthesia or you're having anything like that. So it can be done for any patient.
There is another procedure that we can do, and we can do a surgical excision of the sweat glands, and that's a much more involved procedure.
Then it's gone.
And then it's really gone. It's gone. It's gone. So we do that in the OR. So those are the two things. But I have to say, since we've been doing Miradry, we actually it is our
Extremely
treatment
popular.
of choice.
Yeah, we do a lot of Miradry.
And it's just easier. It's a lot less expensive. So much more affordable for somebody, because unfortunately this is not covered by insurance. You would think it would be, but unfortunately it is not.
And
So
I guess you would say the recovery for that's a little better too than surgical.
Just a few days, and you don't have any cuts. There's no, you have some swelling and some tenderness for a few days, but that's it. So, what about you? Lauren?
So my experience was different than Ashley's. For me, I didn't sweat too badly, but I had the hair that would grow. Like, I'm Italian, so it's dark. It would just grow daily. I mean, so every single day I had to shave my armpits. But if I just missed, if I missed, well, you know me, I get into the nitty gritty of it. But if I missed one day of shaving, like my arms, I mean, if I lifted up, it looked like there was like a mountain of darkness under there. So it was. I was like, oh. But so that was really the main reason why I wanted to get it done. So I thought about doing laser hair removal first, but knowing that I would need multiple treatments of laser hair removal, and Miradry was really only the one or two treatments, I was like, well, why would I do more than 6 if I can just do the 2 and it can cut out a bunch of different things? So the other part for me is, I was never able to wear women's deodorant my whole life playing sports. I was always men's deodorant only, and I would have to apply twice a day, religiously, like morning and then like later, early evening-ish, I would have to apply again because I would stink. I would.
And that's normal for a lot of people. It's
yeah,
a
and I mean,
thing.
like, if I was working upstairs and I could immediately smell with my arms like lifting, I could smell when it was wearing off.
So it was a job priority.
Yeah, like, I used to carry extra
For the
deodorant in my bag. I had one in my station. I had one in my car, like just for emergencies. And so when I did get the treatment, I got not one session but 2 sessions, and not only did it eliminate almost all the hair. I will say there's like one little tiny strip there that
Which we
I
could
still
spot treat with our
which she would
laser
spot
hair
treat.
removal.
It's just setting up the time to do it. But it's so much better than it ever was. I can now wear women's deodorant if I even have to wear deodorant, which most of the time I get out of the shower and I don't have to wear deodorant for at least like the first 1 to 2 days. Sometimes I might need to put some on, but at the same time I probably just need to shower at that point.
That's too much information. Really too much information.
You know me, I'm here to make everyone laugh.
Showering is foremost.
Yes.
We can't help you with
You
that.
can't help someone shower to get the stink away, but
Miradry was really successful.
Miradry was very successful.
Great.
I would, if to think about the overall treatment now, and I think I got mine done before COVID even. So we're talking at least 4 years ago, and
it's still going
yeah,
strong.
and it's still going
Great.
strong.
No pun intended.
I will periodically wear deodorant now, just like if I know I'm going out, just as more of like a precaution. I think a little PTSD too, like not wanting to smell ever. But I would probably do one more little spot treatment on just like the one area where I still see hair, and then I would probably really be done. But I mean, for 4 years to still have that kind of result, obviously it works and it has long-lasting results as well. So,
Great.
that's my experience.
Any other comments about odor awareness?
Come get a Miradry.
There we go.
That will help you.
Yes. So
We
now
could
that
do
we're
a little
now
field
that
trip.
now that it's a little transition from odor and armpits to back to face again.
Back to face.
So it's rosacea awareness. So we couldn't pick one or the other, so we had to pick both. So we're this time though we're going to talk a little bit about rosacea with a little bit of a demonstration on treatments. So, for those of you that don't know what rosacea is a skin condition that happens in the face, and you get those little red bumps, or you get red and flush in the face. I'm sure you've noticed you've noticed people that this occurs with. So, this is actually caused by a small mite. I know that
There's a few different.
there's a
It's
few
like
different.
there's so many reasons why they don't really
I know
know
what mine is.
100%. They don't really know what necessary. It's heredity. It could be that you've had severe sun damage in the past. It can present itself with they're called telangiectasia, which are those little red veins that are in the face. Those are typically from the sun. Or it could just be facial blushing or little red bumps that you have all over the skin. But it typically presents itself in the same place, which is the T-zone. Almost always once you get into rhinophyma and stuff, which they categorize that as a little bit different than rosacea. But your typical T-zone rosacea can be from a slew of reasons. Always exacerbated by our favorite things: coffee, wine, even exercise, which you never stop your exercise. But there's a lot of different treatments that we have available. The one thing that is difficult with rosacea is it's not really something that's ever cured forever. It's something that will always kind of come out. It's the way that your skin is set up. So what we do between at-home care products and in-house treatments, we just kind of keep it at bay. We have a nurse, Nancy, who suffered pretty bad with rosacea at times, and we've kept her at bay since I started here, so it's been around
And that was just
10 years.
Good skin care.
And I'll get into some of our treatments once we get into the room. But it's also medication. Sometimes it's a medication thing, and they do have to see a dermatologist. But what we can do therapeutically is usually really, really helpful for people. So we can venture on into the other room.
So now it's time to move, everybody. Come follow Derek into the treatment room, and we'll talk about rosacea.
Oh, hello, Sarah.
Hello. Hi, everyone.
Today we have the lovely Sarah. So I'm going to show you an example of somebody this is more of a hereditary thing. So Sarah's mom also does suffer from a little bit of rosacea, and the way hers presents herself, if you can see with the camera, we can get in a little bit closer, you just see a tiny bit of little bumpy redness. Now, with Sarah, it really comes and goes. It can be daily, it can be weekly, and she's a very easy person to treat because what we can do is just use either a mandelic peel, which is in the glycolic family, and what that does is there's a peptide in it that goes after the redness in the skin, and it helps that redness exfoliate out of the skin. That can take up to 6 treatments depending on the severity of your rosacea. So people will opt sometimes just to go in and get the IPL treatment done, which I'm going to discuss in a second. So we have Sarah a little numbed because the way we can describe an IPL is it's a little rubber band snap, which we numb for and gives you a little bit of relief, but it's you can feel it. So with IPL, what it does is it uses various different wavelengths of light, and it penetrates deeply into the skin and goes after the different layers and different colors that are in the skin and eliminates it and kind of turns it into the base color that your skin originally was. Now, like I said, there are different forms of rosacea, and some of those come with what's called telangiectasias, which are capillaries in the face. Those are a little harder to treat, and they take a little bit longer to treat. So with Sarah, we're just going to very gently treat her on a really low energy. It's going to eliminate the redness in her skin after about 2 or 3 days. So today the redness is actually going to be a little more present because we're bringing all of that to the surface. We're going to advise her to cleanse her skin a little more frequently over the next few days, and she'll see that coloration really fade, and she'll see her skin really smooth out as well. Even some of the little bit of bumps and papules and pustules that are associated with rosacea can be resolved with IPL. I'm gonna put my super cool shades on. Apply a little cooling gel. Another really great treatment for this that sort of maintains once you do an IPL treatment is doing red light LED therapy. We do offer a stronger machine that we have here that's more medical, but even the units that people can buy at home and use on a regular basis, they're going to have some success with that.
I really like those shades.
Do you like those shades?
I like those shades.
These are my matrix shades. So again, this is using an extremely bright light at various wavelengths, and it's going in and it's eliminating that coloration from the rosacea. How's that feeling, Sarah? Not too bad?
No.
So we're just going to go over these areas that she's suffering from, like I said, that are typically in the T-zone. And as you can see, the skin's getting a little bit more rouged, and that's good. That means that we're actually hitting the areas that we need to hit. And that's basically the treatment. We'll treat her other side. We won't bore you with that. But something that a lot of people don't realize, even though rosacea is extremely common in middle-aged Caucasian women, it can happen in all skin types. Now, IPL is not something that you can use to treat all skin types because it's going to go after the melanin in the skin. So we have other various ways to treat rosacea in all skin types. We use fractionated lasers at a very light energies, and that's going to go in and it's going to promote healing in the skin. And we can also use our Mandela peels because they won't go after the melanin in the skin as well. So we can treat rosacea of all skin types, and we can do it from chemical-free to using our peels to at-home skincare to maintain those results that you get. So if this is something that you suffer with, we realize that it's really uncomfortable. We also have medical treatments for rhinophyma. It's typical in males that you're really suffering with a bulbous nose. Doctor does a beautiful job on reconstructive surgery with rhinophyma. So yeah, just give us a call and we'll help you out.
Well, for those that can't see me, I'm behind. I'm at the bottom of the table, so we won't switch around. But you're going to have to sign off, Derek. You're going to have to say, we will see you.
So we'll see you for our next topic. Have we chosen?
May 3rd. So we're going to be
3rd?
starting to preliminary summer. So
Ooh.
we're going to be talking about
summer
some
treatments and
good
skincare.
things, trying to get our skin really glowing before bathing suit weather. So
We'll brainstorm. And
That's
if you
right.
have anything that you're interested in hearing about, just write it in the comments. You can message us about rosacea treatments or call us 570-674-5555.
thanks,
Bye,
everybody.
everybody.
See you next
Bye.
month.